Lassa fever is a viral hemorrhagic illness caused by the Lassa virus belonging to the Arenaviridae family. It was first identified in 1969 in the town of Lassa in Nigeria after 2 missionary nurses died from the infection. Since then, Lassa fever has become a major health challenge in West Africa, with an estimated 100,000 to 300,000 cases annually, and around 5,000 deaths. The disease is classified as an epidemic-prone viral illness by the World Health Organization, WHO, putting it in the same category of concern as Ebola and Marburg virus disease. The unique challenge with Lassa fever is that while 80% of cases are mild or asymptomatic, the remaining 20% progress to severe illness with high mortality, particularly among pregnant women. This article takes an in-depth look at the history, transmission, clinical features, complications, diagnosis, treatment, prevention, and global impact of Lassa fever. The story of Lassa fever begins in 1969, when 2 nurses working in Nigeria fell ill and died. The virus was later isolated and named after the town of Lassa, where the outbreak began. Since its discovery, annual outbreaks have been reported across Nigeria, Liberia, Sierra Leone, and Guinea. Isolated imported cases have also been identified in the United States, the United Kingdom, Germany, and other countries, raising concerns about its global health significance. The primary natural reservoir of the Lassa virus is the multi-mammate rat, Mastomus natalensis, one of the most common rodents in sub-Saharan Africa. These rodents often live in and around human homes, making exposure almost unavoidable in endemic regions. Transmission pathways include rodent to human, direct contact with rat urine or droppings; rodent to human, consumption of food contaminated by rodent excreta; rodent to human, inhalation of airborne particles from dried rodent waste; human to human, direct contact with blood, saliva, urine, or other body fluids of an infected individual; human to human, nosocomial, hospital-acquired infections due to poor infection control practices; vertical transmission. Pregnant women can transmit the virus to their unborn child, often with devastating outcomes. It is important to note that casual contact, such as hugging or shaking hands, rarely spreads the virus. Lassa fever is known for its broad spectrum of symptoms, which makes diagnosis difficult in early stages. Incubation period, 6-21 days. Mild cases, 80% of patients. Gradual onset of fever. Mild cases, 80% of patients. General weakness and malaise. Mild cases, 80% of patients. Headache and sore throat. Mild cases, 80% of patients. Muscle pain and chest discomfort. Severe cases, 20% of patients. Facial swelling. Severe cases, 20% of patients. Hemorrhaging from gums, nose, or internal organs. Severe cases, 20% of patients. Vomiting and diarrhea with blood. Severe cases, 20% of patients. Respiratory distress. Severe cases, 20% of patients. Neurological signs such as seizures, confusion, or coma. High-risk groups, pregnant women, especially in the 3rd trimester, face up to 80% mortality if infected. High-risk groups. Fetuses have extremely low survival rates when mothers contract Lassa fever. The most significant complication of Lassa fever is hearing loss. Up to 30% of survivors develop varying degrees of deafness, which can be temporary or permanent. Other complications include encephalitis, brain inflammation. Other complications include shock and multi-organ failure. Other complications include hepatitis and kidney dysfunction. Other complications include death in severe untreated cases. Because early symptoms mimic malaria, typhoid, and other tropical diseases, laboratory confirmation is critical. Diagnostic methods. RT-PCR detects viral RNA rapidly and accurately. Diagnostic methods. ELISA tests identify IgM and IgG antibodies. Diagnostic methods. Virus isolation, conducted only in biosafety level 4 laboratories due to high risk. Early detection is key, as treatment is most effective when started quickly. Currently, there is no licensed vaccine for Lassa fever. Treatment relies on ribavirin, antiviral drug, effective if given within the first 6 days of illness. Treatment relies on supportive therapy, intravenous fluids to combat dehydration. Treatment relies on supportive therapy, electrolyte balance. Treatment relies on supportive therapy, oxygen therapy. Treatment relies on supportive therapy, management of organ complications. Challenges in treatment. Ribavirin is often unavailable in rural endemic areas. Challenges in treatment. Late presentation to hospitals reduces treatment effectiveness. Prevention and control. Community-level prevention. Proper food storage to prevent rodent contamination. Prevention and control. Community-level prevention. Good sanitation and waste management. Prevention and control. Community-level prevention. Avoiding hunting or consuming rodents. Prevention and control. Healthcare-level prevention. Use of gloves, masks, and personal protective equipment, PPE. Prevention and control. Healthcare-level prevention. Isolation of suspected patients. Prevention and control. Healthcare-level prevention. Strict infection prevention and control practices. Research efforts. Several vaccine candidates are under development, but none have reached large-scale use yet. Public health and global impact. Endemic areas, Nigeria, Sierra Leone, Liberia, and Guinea report annual outbreaks. Public health and global impact, imported cases. Travelers have carried the virus to Europe and the United States. Public health and global impact, WHO's priority list. Lassa fever is considered a disease with epidemic potential that urgently requires new diagnostic tools, treatments, and vaccines. The socioeconomic burden is also considerable, as outbreaks disrupt communities, overwhelm fragile healthcare systems, and create stigma against survivors. Conclusion: Lassa fever is a neglected tropical disease that continues to challenge public health systems in West Africa. Its unpredictable outbreaks, high mortality in severe cases, and long-term complications like deafness make it a pressing concern. While supportive care and ribavirin can improve outcomes, prevention through rodent control, improved sanitation, and stronger healthcare systems remains the most effective strategy until a vaccine becomes available. Greater global awareness, research funding, and public health preparedness are critical if the world is to reduce the impact of this deadly viral hemorrhagic fever. References: World Health Organization, WHO, Lassa fever fact sheet, Centers for Disease Control and Prevention, CDC, Lassa fever overview, Ogbu O, Ajuluchukwu E, Uneke CJ, Lassa fever in West African subregion, an overview. Journal of Vector-Borne Diseases, McCormick J.B. et al., Clinical and Epidemiologic Characteristics of Lassa fever, Journal of Infectious Diseases.